Expatriate medical insurance. What to expect when you are a pregnant expat. Having a baby in another country without the support of family and friends in an unfamiliar healthcare system can prove to be a challenge for anyone. So if you are a pregnant expat, here are a few pointers that could help reduce that overwhelming feeling. Don't be afraid to ask questions. It is important that you educate yourself about the healthcare system, pregnancy, and giving birth in the country. Doctors may not be forthcoming, particularly if there is a language barrier. Self-advocacy is important, so don't be afraid to ask questions about a procedure before it is performed. This will also help you achieve the birth experience you want. Finding a doctor. Choose your doctor based on referrals and language requirements. For instance, if you are an American giving birth in Germany, opting for an English-speaking doctor is only natural. If you are in a country where women receive prenatal care from doctors who work in local hospitals and clinics and see patients by appointment, it is unlikely that you will see the same doctor throughout your pregnancy and in the delivery room. This is a far cry from private obstetric practices in other countries. Picking a hospital. While public hospitals in some countries are inexpensive and efficient, they will also be very busy. In this case, establishing a rapport with harried nurses and procuring a private room will be difficult. Shop around and visit different hospitals, both public and private, to see the facilities and check their flexibility in accommodating birth plans. Talk to the staff and see how they answer your questions to estimate their thoroughness and friendliness. Cultural practices. Accept the fact that something you consider perfectly acceptable in your culture could be appalling in another. Like one American expectant mother was surprised that no one bats an eyelid when an obvious pregnant woman orders potent coffee at a cafe in Scotland or a pint down at the pub. Working woman and maternity benefits. If you are a working woman, then some research on maternity benefits would do you good. For instance, a mother to a 2-month-old in the US could be thinking about putting her baby in daycare and getting back to work, while her counterparts in Canada could receive up to 14 months of paid maternity leave. Discrimination against pregnant women comes in different forms across the world. Some countries like Turkey have very favorable labor, health, and safety legislations. But this also means pregnant women could prove to be expensive from an employer perspective, which is why they are often laid off for different reasons. Read up on benefits like leave entitlement for checkups during pregnancy, duration of maternity leave before and after birth, special rights for breastfeeding, and so on. Childbirth models. Ideally, women should have the freedom to choose from the 2 basic models of managing childbirth: the medical model and the midwifery model. But in some countries, home births are not permitted, in which case you have no choice but to navigate the country's healthcare system. Postpartum care. Many Gulf countries have better outcomes in terms of maternal and fetal deaths when compared to their Western counterparts. The biggest advantage of delivering in the Gulf and Asia is the availability of postpartum care, since it is common to have household help. Health insurance. The cost of delivering a baby could be high in most countries. Costs differ in public and private hospitals for vaginal deliveries with a 3-day stay, with an extra charge for an epidural or cesarean section with a 4-day stay, and are very high if there are complications in childbirth. Expats with health cards do not have to pay for deliveries at government-run facilities in some countries. Did you know that most policies do not automatically cover pregnancies and nursery care for premature infants? If you are thinking of starting a family abroad, it's best that you choose an expatriate medical insurance before your pregnancy. Insurance plans usually cover pregnancies only with a 10 to 12-month moratorium. But if you are already pregnant, talk to your insurer and see what extra premium is payable. You can start now by comparing the major providers: Bupa Healthcare, Clements International, Expat Plus, and more. Or request a free quote from an independent broker to help you compare the market and find the best solution.